So one of the things that we learn in our training about relation to aspiration is that we need to look out more cautiously for right-sided lung issues than left-sided, because there is some suggestion that aspiration is more likely to occur on the right side, given that the branch from the trachea into the right lung occurs slightly before the left lung. Is that still valid? Is that a bit of a myth now in terms of aspiration management? What's your opinion?
Again, we were taught the same in college, and I think there's a bit of a myth to it. There's probably a slight bias towards going to the right rather than to the left. There's different ways we have of suspecting aspiration clinically. One is on a CAT scan, and on a CAT scan you'll often see what's called bronchiectasis. Bronchiectasis is abnormal dilatation of the airway in comparison to its adjacent blood vessels. So normally everything narrows as it goes out in the lung. The bronchiectasis is when the airways are preferentially dilated. So often in people that aspirate, we see basilar bronchiectasis, and it tends to affect both sides of their lung. So the subtle early CT manifestation of recurrent aspiration is bilateral basilar bronchiectasis, meaning the bottom of both lungs have abnormally dilated airways. The other thing that we often see with aspiration is that dependent areas of the lungs get affected more. So often we see patients with funny patterns of infiltrates on their chest x-rays. The right lung is divided into 3 lobes, the left lung is predominantly divided into 2 lobes, the left upper and the left lower, and the lingula comes off the left upper, the right upper, right middle, right lower. Sometimes you'll see people with a right upper lobe pneumonia and it's sparing the rest of the lungs, and often in the right clinical context you might suspect that that patient is aspirating.
Okay.